Welcome, Dr. Galvani. Thanks for joining us today.
Thank you for having me.
You have refined a new surgical weight loss procedure at University Medical Center. Describe exactly what that means.
Well, what we did is do surgery for surgical weight loss through the belly button. And that belly button can hide the scar on this particular patient, and we perform the whole procedure through that. Why is that different? Because we performed that surgery before with 5 half-inch scars spread through the abdominal wall, and now we came down to just 1 half-inch scar.
With the same result.
With the same result, correct.
Which is exactly, what are you doing? What is that procedure?
This was a lab band procedure, basically a procedure to make people lose weight. People that had tried any available diet have not been successful with it, and then they tap into surgery as a tool in order to just help them get there.
So, and also describe the other benefits that come with this particular surgery. You have just one tiny incision. What about the pain? What about the procedure? Is it significantly shorter?
Correct. So, as you know, minimally invasive laparoscopic surgery was brought up to mainstream like in late 1980s. And then laparoscopic surgery is usually surgery performed with very little scars, 4 or 5 in the abdomen. So that's what we used to perform up to 2007 when single incision surgery came about. 2008 is when I started to perform these procedures, and then of course by cutting less you have less pain, potentially less pain. There is less risk of wound infections because of course you're having less scars, and then less potential risk of wound complications as well. Not talking about the cosmetic benefit that patients, obese patients don't come to see me because of cosmetic benefits. That's the wrong reason to get that kind of surgery. But if you can get it, I think it's a plus.
And who is this procedure designed for? Who are the patients that you serve?
So, we have indications for bariatric surgery that we offer to people, and there are certain standards that have been mandated by the National Institute of Health. So single incision surgery is not for everybody. So far we are offering it to a selected group of people because I think it's still early in the experience. I have been doing this surgery just for 2.5 years outside Arizona, but we started doing it back in 2008. So we select the patients and try to offer it to the smaller patients so far.
And how have your patients responded? What has been their reaction?
I'm going to talk to you about the experience I have from Chicago because this is what I have the most experience with. Patients at the beginning didn't know what to expect because they say, okay, 1 scar was the big deal about it. But then once they see themselves in the mirror and they see that they can't see any scars, they really like it mostly because about 90% of the patients that undergo bariatric surgery are women. So of course they want to look healthy, but if they look better, they also like it.
But this does work, right? This does work. And what's the typical response for patients? Are they able to go on to eliminate these symptoms of obesity?
They do. There is a number of patients that have some weight recidivism, like maybe 15%, 20% in some cases. But everything has to do with the patient mindset. But still 80-85% of people do really good. They do not take their home medications like for diabetes, hypertension, arthritis. Some of them use a mask to sleep for a sleep apnea. So they do get rid of that and they put it in the closet for good. So it is really good and advantageous for them.
And this is a new procedure, but once it becomes more mainstream, do you see that there is a potential to lower the cost of this type of procedure in the long run?
Well, by using less tools, intuitively, I would think that it might. Right now, the tools we're using are kind of the first stage, and the procedures are being performed just by few surgeons across the world. But as more surgeons become and more companies come up with new tools, then probably the pricing is going to go down, and then of course you're using less, so you're spending less. And then the other advantage of this is that patients go home the same day. So it's like gallbladder surgery. You do surgery 2-3 hours later, once they are recovered and fully awake, they can go home. So that's huge.
So that does have some potential to lower costs. But what are some of the other possible applications for this type of procedure? I know that it can be used in other areas.
Correct. Laparoscopic surgery is trying to go minimally invasive, basically. And for the last 5 to 6 years, there are two trends. One is single incision surgery, so doing surgery through the navel, through the belly button, for gallbladder, for reflux disease, for major liver surgery, for kidney disease, or for kidney donor. So that is one of them. And the other one is using natural orifices to do surgery. So that could be the stomach, so removing organs through the mouth, or the vagina, or the rectum in men. So trying to decrease pain, decrease wound complication, and also patient postoperative pain, which is one of our main problems.
You came to the University of Arizona recently, one of a number of doctors who have been recruited in a really big initiative to beef up the surgery department, correct?
Correct.
What have you seen as a result?
Well, I see that patients are coming to us, and I'm not talking about just my specialty, but neurosurgery, ENT, colorectal surgery, endocrine surgery. They're coming looking for the specialist, and they're coming with really complex problems sometimes that we feel we are serving the community that way.
Well, it's been very nice having you here. Thanks so much for joining us.
I appreciate it. Thank you so much for having me.